All right, welcome to our explainer. Today, we are digging into a real mystery, one that just might be the hidden source of your headaches, that weird dizziness, maybe even that ringing in your ears. We're going to uncover the secrets of one of the most important, but also one of the most misunderstood muscles in your entire body. So let's just jump right in. Do you ever get those headaches that just won't quit? Or a strange feeling of being off balance? That nagging ringing in your ears? Tinnitus? It's so easy to just blame stress or maybe a bad night's sleep. But what if I told you they could all be pointing back to one single, kind of surprising cause? And believe me, it doesn't stop there. The list of strange symptoms is actually pretty wide. We're talking about stuff like pain behind your eye, that feeling of a full or plugged up ear, sinus pressure that feels like a cold but isn't, even dizziness, vertigo, pain when you swallow. All of these things seem totally disconnected, right? Well, they can often point back to our one culprit. So, who is this master of disguise causing all this chaos? Well, it's time to meet the muscle at the very heart of our story, the sternocleidomastoid, or let's just call it the SCM for short. I know, it's a total mouthful, but stick with me, it's way simpler than it sounds. See that super complicated name? It's really just a map. Sterno refers to your sternum, that's your breastbone. Clado is for your clavicle, which is your collarbone. And mastoid is that big bony bump you can feel right behind your ear. That's it. It's literally just named for the 3 points it connects. Pretty simple, right? Go ahead. You can actually feel this right now. Just turn your head to one side. See that big rope-like muscle that kind of pops out, running from behind your ear down to your collarbone? Yep, that's your SCM. You've got one on each side, and as you're about to see, their job is incredibly important. And honestly, it's no wonder this muscle gets overworked. Just look at this list. The SCM is your neck's ultimate multitasker. It's what turns your head, tilts it, bends it forward and back. It even helps you chew and plays a role in breathing. I mean, this muscle is a true workhorse, constantly on the job. Okay, so if this muscle is so vital, how on earth does it cause so much trouble? Well, the answer lies in something called a trigger point. And this, right here, is where the whole mystery starts to unravel. So what is a trigger point? You can think of it as a tiny, angry, balled-up knot in your muscle. It's this hyper-irritable spot that's stuck inside a tight band of muscle fiber. And when you press on it, it's usually pretty tender, and it can cause a really fascinating and frustrating phenomenon. And that phenomenon is called referred pain. This is the absolute key to our mystery. It means a problem right here in a knot in your neck muscle can actually create the feeling of pain way over there in your head, your ear, your jaw. The pain shows up far, far away from the actual source of the problem. And this is the big aha moment. That angry little knot, that trigger point in your SCM muscle, is sending out pain signals along shared nerve pathways. It's almost like a faulty electrical circuit. It tricks your brain into thinking the pain is coming from your forehead or your eye or your ear, when the real problem is actually down in your neck. So this is how it all connects back. That pounding headache, the ringing in your ears, the dizziness, the facial pain, all those confusing symptoms we started with can so often be traced right back to these sneaky little trigger points in your SCM. It's the classic case of one single source causing a whole bunch of different symptoms. Okay, so now we know what's happening, and we know how it's happening, but the really big question is, why? Why does the SCM get so angry and overworked in the first place? Well, as we're about to see, the reasons are probably a very familiar part of your daily life. I mean, does any of this look familiar? That classic text neck posture from constantly looking down at your phone, a work-from-home setup that's not quite right, cradling your phone between your ear and your shoulder. Even something like sleeping on your stomach or grinding your teeth at night can put immense constant strain on the SCM. And that strain is what leads to those painful trigger points. But here's the good news. Now that we've identified the culprit, the mechanism, and the motive, we can finally talk about the resolution. The best part is there are really practical, effective things you can do to find relief and to stop this from happening over and over again. I think it's helpful to think about this in 2 parts. First, there's immediate relief. Things like gentle self-massage or maybe some heat or ice can really help calm down an irritated muscle right now. But for long-term health, the real goal is to fix the root cause. And that means things like safe, regular stretching, and most importantly, correcting your posture. And you can actually find these spots yourself. Remember how we found the SCM earlier? Just turn your head and then, very gently, pinch that ropey muscle between your thumb and fingers. Kind of walk your fingers up and down its length. If you find a spot that's particularly tender or sore, yep, that's likely a trigger point. Just gently hold that pressure for about 30 seconds until you feel it start to ease up. Now, stretching is absolutely key for long-term relief. Here's a really safe and effective one. Start by sitting up nice and tall. Gently tilt your right ear towards your right shoulder. Then, from there, slowly rotate your chin up towards the ceiling. You should feel a really nice, gentle stretch all along the front and side of your left neck. Just hold it there for about 30 seconds, remember to breathe, and then slowly repeat on the other side. And look, prevention is really all about making small, consistent changes to your habits. Raise your computer monitor so it's at eye level. Use a headset for long calls. Please ditch the stomach sleeping and get a supportive pillow for sleeping on your back or side. Get up and move around every hour or so. And since so many of us hold tension in our necks, finding ways to manage stress is a huge, huge factor. Okay, this is really important though. It's crucial to know when self-care isn't enough. If your pain is really severe, if it just isn't getting better after about a week of trying these strategies, or if it started because of an injury like whiplash from a car accident, it's definitely time to see a doctor or a physical therapist. Don't try to tough that out on your own. So the next time you feel a headache coming on or you get that dizzy spell and you reach for a painkiller, just pause for a second. It might not be a problem with your head at all, but a signal from your neck. Your body is always talking to you. The only question is, are you ready to listen?